Welcome back, everyone. I can see Dr. Abioye, Dr. Yakin, Oyo. We can just give another 2-3 minutes for more people to come back. Then we'll start question and answer. So I think we can start question and answer section now. I don't know. Does anyone have any question based on Dr. Abioye's journey? Does anyone have any question readily for him? I have some myself, but I would like for maybe people in the audience 1 or 2 before I go into the ones I have.
I have a question.
Please go ahead.
Okay, thank you. So I caught at the beginning of your story where you said you did an MPH in Harvard. You said 2011. So I was just doing the maths in my head. That's basically like right after maybe NYC.
Yes.
Yeah, so I think generally, at least the impression here is getting into those schools can be, not can be, it's tough. Then I'm not sure if it was a funded scholarship, a funded program, or you paid for it yourself. So I'm just curious about how you were able to position yourself to be able to get into such a top tier program, basically almost right after school, because NYC and house job years they don't really count, or depending on how you use it.
Yeah. So during NYC, I basically devoted my NYC year to figuring out next steps. So I wrote my primaries in surgery, and I also did GRE. So I kind of like spent the year of NYC with the mindset that I was going to move to the next step of whatever it was, and that, and so the way it happened was that I spent a lot of time studying for the GRE. I did well, and I got in. It wasn't a fully funded program. I got a part scholarship, but most of these programs give you opportunities to get loans, that you pay out for the next 25 years, 30 years or so. And it ends up being okay if you have a good job or a decent job, over the next decade or so. It's harder if you're out of a job at any point in time. So it's sort of like if you have writing the exams. But also, I think that the other thing that, there are a few things that I will say that will put you apart, in these applications. One is that if you're a medical doctor from a developing country, you're sort of regarded on the same par as medical doctors from the US and and all developed countries. And so what you really need to do extra to set yourself apart, especially for a master's program, is not huge. If it were a PhD program, it will be different. If you've had some work experience and you do well in the GREs, and you've had some work experience, you do well on the GREs, and you write a decent statement of purpose, you have a fair is the GREs to be. The GREs will require you to write essays. A lot of people haven't written essays in a while. And you write 2 essays, you write an argumentative essay and one other kind, I don't remember, I think it was a narrative essay. And you have to prepare for these things, So most people are not able to take the time out to actually prepare for these things. So, it's not, you have to take time out of your regular work to do it. So, and that's just it. I wouldn't say that, then that makes it so straightforward. But I think that gives you the basic minimum to have a fighting chance, to be able to at least have your applications be examined. And maybe someone gets excited about what you write, in the statement of purpose. So maybe there's like 40 of you who have similar application materials, GRE scores, and all of that, and they're going to select 10. Of course, there's some degree of luck involved, but then there's also the way that you write, what you write, and all of that, your experiences before coming. So it depends on what you write in the statement, how it reflects who you are, that might sway someone who will then say, okay, let's take this person. So I hope I answered your question.
Yes. Thank you.
Okay. Thank you.
Thank you, Dr. Abioye. I think someone has a question in the chat, which is actually one of my questions as well. Comparing doing an MPH in the US and possibly compared to maybe UK or somewhere else, what's the difference in the program and also employability post the program, and what would you say about that?
So honestly, I don't want to be so here's the thing that I've come to realize about the MPH program. It's not a great program. Okay. It's sort of like supposed to indicate on your resume that you're trying something. It's not going to teach you everything that you need for a career, but it can let the potential employers know that you're interested in this field, you have some general knowledge. There isn't a lot of rigor in most MPH programs, at least not the one that I attended at Harvard. And that's sort of like the view that many of the people that I did the MPH program with, many Nigerians at least, that's sort of the view that we got. Now, but then how does that affect employability? I think that the question of employability is a complicated one because it brings factors like which country are you trying to be employed at, immigration issues, do you have a permit to work in those places, what jobs are you seeking? So it's a complicated question and it's really hard to answer, to be honest. I think that the more important factors to be in as far as getting a good job are concerned is not really where you did the MPH. It's also whether you're able to work in that country for a few years, and what does that mean for you? So if you want to work in the US after your MPH, you have about 1 year after the MPH where you're sort of given a work permit, and then after that you have to figure things out. Or if you did epidemiology or one of those math STEM-based programs, the MPH is not regarded as STEM-based. If you did a STEM-based program, then you might get longer period after your F1. I don't know what the rules are in the UK, but I think that it's not really about whether the UK or the US. It's also about what happens next. It's about where, in the end, you will learn about the same things. UK people will probably employ US people, UK MPHers above US MPHers. US programs will probably employ US MPHers above. But then the question then will be, if you leave the UK and the US, which is like the biggest school countries as far as schools are concerned, and you go into like the World Health Organization, World Bank, and all of that. Again, I think what really matters is not the name on your degree. It's factors like what your network looks like, what other skills do you have. So if you've worked, so I had friends who had worked extensively at maybe consulting at the World Bank before their MPH, or consulting at UNICEF, or doing some work somewhere. You wouldn't, even if they did their MPH at a second tier school, you wouldn't be able to compare them to people who do their MPH at Harvard. And this is just true, because that Harvard name is not going to be enough to knock off the network that they're bringing if the Harvard person does not have a network to leverage, or is not leveraging the Harvard network appropriately. So basically what I'm trying to say is that there are no rules. There are no like hard and fast that, so if this happens and this has to happen and this has to happen. At every point in time, you have to ask yourself, what do I have? What can I do with it? Not necessarily feel scared about, I have to do this because it improves employability. I used to be like that. I used to be a guy who thought, it has to be Harvard, it has to be. But over time, as I've interacted outside of the Harvard network, as I've met other people, I've come to realize that, you can do very well without necessarily going to a top tier school, as long as you're ready to apply yourself and build your network, yeah. So I think that I think is my answer to the employability question. It's not the school per se, or whether you went to school in the US or the UK. It's also other factors, like the skills that you had before the MPH, like the network that, so some people don't have a large network, but they're able to cold call, reach out to people, email people. All of those will affect your employability above and beyond factors like, whether you went to school at Harvard or, clearly, if you have two people who, so above and beyond whether you went to school in the US and the UK, I think that's the question. So would it be better to focus on an MSc in health economics and policy, epidemiology? I think it really depends on what you want to do. Okay, if you really want to work in public health, I will say that the MPH is not necessarily what you need if you know what part of public health you want to work in. If you know that you want to be an epidemiologist, then do a degree in epidemiology or in biostatistics, because those give you the skills that employers are going to care about, that you're going to find that you need. The MPH program tends to be like, it gives you a breadth of knowledge. And I will say that it's most appropriate for people who don't want to use it to build their careers. So what I mean by that is that it's not the basis upon which you're building a career, it's an add-on. This is my thinking. It's not enough by itself. You have to do a lot of other things. But if you did an MSc in epidemiology, or say health economics and policy, those degrees already have niches within public health that you become sort of like an easy fit for, because you have skills that they want you to have known that an MPHR might not know, because the MPH person has a breadth of knowledge about so many things, but not necessarily rigor in epidemiology methods, or doesn't know what the cost effectiveness model is, which an health economics and policy person would know. So I think that if you know exactly what you want to do after you graduate, then select your degree based on that. If you're not sure and you think, I want to do public health, I'm not sure what I'm going to do, then you could do an MPH. Or if you've already, you're a clinician, but you're just looking for something to add as a feather on top of your hat, so to speak, then an MPH might also make sense. I mean, this is coming from me who did an MPH. So I might have that bias that I kind of realized that my MPH is not really, I mean, so what the MPH did for me was indicate to my employers that I'm interested in this thing. But I wouldn't say that it really gave me the skills that I needed. I needed to do a lot more. I needed to craft that MPH itself in a way. So if you look at the degree, the courses that I took for my MPH, they're really different from what a typical MPH I will do, because I included a lot more research methods in my MPH, unlike the rest of my colleagues who did MPH programs that gave them a breadth of knowledge, but not necessarily depth in one field that then allowed them to build upon it. Even then, even though I knew I had all of these skills, employers were still skeptical of what skills I brought to the table, because once they saw that you had an MPH, there was a sense that, oh, you know all of this stuff, but you might not know the thing that we really want. Because if you imagine that a lot of employers have a small piece of public health work that they're doing, they're not doing everything else. So an employer might not be doing a lot of policy work, but they're doing a lot of statistics work, and the MPH didn't give you the depth of statistics that they need. That's sort of like my understanding of the question of whether health economics and policy, it's really, what do you want to do? And then craft your research based on what you want to do, not necessarily based on, not the MPH shouldn't be like a focus. So I have to do the MPH. If you know what you want to do, then just do what you want to do rather than the MPH. I hope that answers my question.
I think it does. Thank you, Dr. Abioye. I'm taking over from Kumi for now, so I'll just run through some of the other questions we have.
Okay.
There's one on the difference between global health and epidemiology.
Okay. So should I take that, or you want to read them out? I think I should take them one after the other.
Yes, yes. So let's do this first, then I'll tell you the next one.
Okay. All right. So I think global health, the term global health is a fairly new term in the public health lingo. It's maybe 15 years at the most. Before that, there was international health. And the international health used to be people from developed countries coming to developing countries to help. Like flying in on aid, working for aid agencies, that type of thing. But the global health term flipped that. So global health then said, oh, anybody can do this work, but they should be doing work that advances the health of all of us around the world. So global health itself is public health on a global scale. And that's different from epidemiology in the sense that epidemiology is focused on diseases, on disease and health conditions, the determinants, that typical epidemiology definition, the distribution, the determinants of diseases. So epidemiologists are those that will care about how do we identify the risk factors for diseases, how do we address those risk factors, how do we prevent them, how do we control the diseases like infectious diseases, for instance, how do we understand the sort of project how diseases are going to continue in our population, what are the numbers that we should be expecting, that sort of thing. Epidemiology tends to be heavier on numbers, I would say. It tends to be more research focused, even if it's not academic research, even if you're not writing papers, there's a lot of investigation in epidemiology. And epidemiology is part of global health, or it could be part of global health if the focus of the person who is doing epidemiology is on advancing the health of the global population, or who cares about a condition that affects people all around the world, not necessarily in a small locality, So I think that's really the distinction. So if you think about it that way, global health is a wider umbrella, and you have other things that will be under global. So if a person does health economics, but does it with a global lens, then that's part of global health. If a person does medical sociology, but then does it from a global lens, then that's global health. If a person does health policy, then also that's also global health. There's a new field of implementation science, where we're figuring out how to deliver programs and projects, but we're doing the science that helps us to do a better work of it and demonstrate that it works. That's not exactly epidemiology. That's more global health, but implementation science is part of global health as well. So it's sort of like global. You think about global health as public health with a global lens, but then epidemiology is a part of it, or epidemiology could be a part of it if you're focusing your epidemiology on a global lens. So if you're doing HIV epidemiology, for instance, then that's really global health as well. If you're doing work in anemia, the factors that, issues that affect people all around the world, and you're looking at it from a global lens, then you're doing global health. But I think that when a lot of people think about global health, they're looking at UN agencies like the World Health Organization. They're thinking about NGOs. They're also thinking about they're also thinking about like big NGOs, big research institutions like Harvard, like Columbia University, Oxford, stuff like that. It's often what people are thinking about, but it's not necessarily that. You could be working within LASU community health department, but also be doing global health. So and that's the distinction. But you could also be doing epidemiology. So you could be doing global health and epidemiology. It's just terms that we use to define whatever it is that we're doing.
Okay, so thank you. I think basically global health is a wider umbrella than epidemiology, and it can embrace a lot of public health, especially as long as it summarizes it. So the next question, we have a couple of questions left. So from Dr. Yakini, specifically for the biopharma industry, said, how important do you think a PhD for someone with a medical degree from Nigeria is, and how important are things like where the degree is from, top tier school or not? So I don't know if he wants to elaborate more on that question. Basically saying how important is a PhD for someone with a medical degree from Nigeria for the biopharma industry, and how important are things like where.
Yeah, thank you.
Yeah, go ahead.
I just want to talk a bit more about the question. The reason I'm asking is I've spoken to a couple of friends that mentioned that for you to go as far as possible in your career in the medtech biopharma industry, if you're a doctor, you either have to have completed a residency or get a PhD as a scientist. So like you don't do that, you limit how far you can go. And I'm also wondering, in getting into that industry, getting into the big companies, for instance, how important will things like where you got your degree from be, if you got it from a top tier school or not?
It depends. It depends on what you're doing in biopharma. So biopharma is why it's a lot of careers. So for instance, if you're going to do health economics or epidemiology at a biopharma company, then a doctoral degree will help. A PhD will really help you. If you're going to do commercial work, market access, forecasting, those kind of things, you might not need a PhD. Just thinking about the colleagues that I've worked with who have done well they have not necessarily needed a PhD. So I think it depends on what you're really doing. If you're working in tech within biopharma, you might not necessarily need a PhD. However, that said, if you have a PhD, there is a wide variety. So in clinical development, for instance, where clinical development is, for those who might not know, is the early aspect of developing a drug. So somebody discovers a new drug and you're trying to bring it into the market. There's a lot of work that goes on between discovering the drug in the lab and making it ready for prime time. It takes about 5 to 7 years for many companies. And there's a lot of individuals who are involved. There's epidemiologists who are involved. There is statisticians who are involved at that stage. There are medical doctors who are like maybe specialists in that field. So if you're developing a sickle cell drug, for instance, you might have a bunch of hematologists working for that pharma company. You might also have immunologists, because you're thinking about the complications. You might also have, so there's a lot of careers that are possible between the discovery of a drug until launch. So there's also some plasticity. There's some degree of moving from one career to the next. So if you do a PhD in epidemiology or statistics, for instance, you might be able to work in health economics and outcomes research. You might be able to work in epidemiology as a focus in biopharma. You might be able to work in clinical science. You might be able to work in medical, especially if you're a medical doctor. You might be able to also work in medical affairs. So it gives you options. If you have a PhD in maybe stats or epi, that kind of thing. If today you start in health economics and tomorrow you find a new role, but it's not in health economics, it's in something related, it's in clinical science, it will be easier for you to jump. So you have multiple options of career tracks that you could pursue, but also you are respected better within your field, among your colleagues. So I have colleagues, for instance, who don't have degrees, who don't have PhDs rather. But the people who have PhDs tend to respect each other's thinking when it comes to technical issues, and also they're thinking about technical issues is better respected in the company, and it's likely to improve their career prospects. Okay, but that doesn't mean that, again, like I said earlier, that there are no rules. It doesn't mean that that if you don't have a PhD, that there aren't alternative ways. So if you have experience, for instance, like if you have a lot of experience doing this thing, people will respect you better than if somebody just finishes PhD and is coming on board. Because a lot of the things that people do in biopharma, nobody's going to teach you in school. Like how does the FDA want you to write this document, for instance? It's not going to be taught in any class. It might not be taught in any class. Instead, you would learn it through experience, and that experience will make it more likely for you to have a career that advances or improve your career prospects. So that's really what I'm going to say. That the decision about a PhD depends on what you do for pharma, and we can talk some more if you want to share ideas and if you want to tell me exactly what you're planning to do. But in general, if you have a PhD, you might have more flexibility, especially if you have a PhD that sits in that start epi niche. You might have more flexibility as to what you do. Also, if you have a clinical degree, no, not a clinical degree, if you're like a clinical specialist, a nephrologist, a neurologist, whatever, you also have a lot of flexibility and a lot of, and it improves your prospects. So for instance, you might be able to work in clinical science, you might be able to work in medical affairs. You would have a number of options of things that you can do. And so it helps, to be honest. It does help.
Thank you so much. I think I would just reach out to you to go into more details, but thank you so much for the answer.
Yeah, I'm happy to talk some more.
Okay, thank you. We have two more questions. So I think in a way you've answered One, why get a PhD after an MPH?
Yeah.
You've chipped in one or two things that. And then, so you can just answer these two together. So why get a PhD after an MPH, and the requirements for a career in clinical trials, based on your experience so far?
I think that it depends on what you want to do. So I keep saying that it depends, because thinking about the people that I've met during my career, working in all these spaces. So in clinical trials, for instance, there's many professionals that are involved. There are regulatory specialists, there are statisticians who are involved, and these two are sort of staples. You need a statistician when you're designing the trial. You need a regulatory specialist to make sure that all the ethical aspects of the trial are properly met. Even the smallest clinical trials, 1,500 people or, whatever, 5, 10 people, you still need the regulatory specialists to make sure that you're meeting the ethics. So those are steady careers in clinical trials. But how about the investigators? And this is, I think, one thing that a lot of us underestimate, that you also need the investigators who are going to design the trials, who are going to say that the trial is even necessary at all, who are going to identify the need for an investigation. And so that's where a lot of clinicians come to play, a lot of PhDs who are doing biomedical research come to play. If you're working in the device industry, for instance, engineers might have a role, but when you think about the clinical trial, the most traditional specialty in clinical trials is statistics. They have a very central role in clinical trials. Like, even whatever you do in a clinical trial, you will need a statistician. And very often, if it's not a big trial, if it's a trial that it's not funded, you don't have a lot of money, if you might be able to do well with just a statistician, a lot of the other professionals, you might be able to cut corners around. A statistician who is a clinical trial specialist might understand the ethics, might understand the regulatory aspects, might understand the management pieces, because clinical trials is a lot of logistics, there's a lot of management, there's a lot of financial management, paying staff, making sure that reagents are ready. So sometimes for instance, when I was leading trials in Tanzania, in the end, I wasn't thinking about the science very often. Instead, I was thinking about, we have data to collect at this clinic. How do I ensure that cars are available to get there? How do I ensure that patients, that staff are on call around the clock so that somebody can call them when they're going into labor? We had a trial where we're collecting placentas from women. So if a woman who was in our trial was going into labor, she gave us a call, and then one of our staff had to rush down to wherever it was that she was going to deliver. So there's a lot of complex logistics also involved. But at the very basic of it, if you really are interested in clinical trials and you have a quantitative bent, I would say statistics will give you the first jump. I hope that answers the question. I think the other question was why PhD after an MPH? I think that we've sort of talked about this. Yeah. I think we've talked about this off a bit. It depends on what you want to do. There are no rules that you must have after an MPH or after an MSc or whatever. It depends on what you really want to do. If you want to work in academia, you want to teach, you want to do research, a PhD makes it more likely that you will have a good career. So for instance, when I first came back to the US, I looked at my publications and I thought, I have all these papers, maybe I don't need to do a PhD, because if I did a PhD anyway, it was just going to be, I was just going to do more research, I was just going to write more papers. At that time, I already had, maybe 15, 16 papers. So I thought maybe I didn't need it. But then when I started to speak to some of my mentors who are professors at top tier universities, so one of them told me, hey, guy, you're going to not be able to get to the top of your career in academia if you don't do a PhD. You're going to be limited in the spaces that you'll be allowed into. You're going to be limited in the roles that you'll be allowed to get, and you'll be stuck. A few years down the line, you'll not be happy. By then, maybe you're too old to do the PhD. You have a lot of responsibilities. So I think that if there is a chance at all that you might need a PhD for a career that you want, I think you should seriously consider it earlier on in your career before you have a lot of things that are pulling you in 100 different directions. So I hope that sort of answers your question. There is no perfect rule for why you need a PhD, but I think that if you're going, you should probably err on the side of caution. If you think that I might need it for the career that I want, then seriously consider it. Look at what you need to be able to do it. But if you don't need it, like if you want to work in operations in public health, so there are a lot of So I have friends who work in operations who are involved in like supply chain for big NGOs. They're medical. Some of them are medical doctors. They don't need a PhD for that work. There's no reason for them to get a PhD. If you want to improve the way that operations are done for the delivery of vaccines and you think you want to do research around it, then that's different. You might need a PhD for that. So defining exactly what you want. I know it's not always easy because when you're starting out, you don't even know what's possible. That's where speaking to mentors, I know I used to knock down the doors of my professors very often when I was in medical school. I had a few of them that I would speak to again and again. I was very confused about what I was going to do. And eventually one of them told me, just wait and see. Collect as much information as you can. Go through this was before house job. Go through house job, see what you like. If you don't like anything else at the end of house job, keep looking. Basically but collect as much information as possible. Ask questions. That is what I think might help. There isn't like a rule that for you to have a career in epidemiology, you don't necessarily need a PhD. If you're going to have a career in epidemiology in Nigeria, for instance, you might be able to do well by doing a residency in public health, and then getting the epidemiology experience that you need. So there's always like multiple ways to get to the same place, and asking questions might help. I hope that's sort of helped. Yeah.
Yes, it does. It does perfectly. We're almost I think basically the questions are finished, and just to summarize as much as possible.
Yeah.
So you've spoken about the importance of reevaluating regularly, looking at where you are from time to time and asking the important questions. You've also spoken about academia and the opportunities within it, and the fact that financial considerations are actually important in also making choices. I think you've also touched on different aspects of public health and explained the difference between some of the aspects, and also answered some questions about going to a top tier school versus going to a regular school in quotes, regular is in quotes and now. So I think we've really explored a lot. There's a lot to unpack from this session actually, and in the absence of any other questions, I would just like to say thank you very much for taking out time to talk to us about your experience. And I've actually left with a lot of things to think about. And I think there's something important you said as well. It's okay to not say know what you want to do exactly, but if you keep asking questions and you are open, you find it eventually. And it's also okay to reinvent yourself as you move down the ladder. You shouldn't give in to that idea that I've spent so much time in this, so I have to consider. Thank you very much, Dr. Abioye. Thank you, everyone, for joining today's session. Till next time.
Thank you very much.
Dr. Abioye.
Yes,
thank you very much.
Reach out to me after this session if you have questions. I'm happy to speak someone.
Okay, so
thanks,
he said,
everyone.
yes, all right, thank you. Bye.
Bye.